and I'm going to present what we've been working on in collaboration with Eurordis and my colleague here, Stephanie, from UCD. And we're based in Ireland, working under the Health Research Board Rare Disease Catalyst Consortium project. One of our projects here we're going to speak about today is the development of a patient-reported experience measure, the PREM tool for rare disease. And our insights from our stakeholders that we've consulted and talked to along the process so far. So just to zoom out for a second and talk about what actually are PREMs and what are the needs for these tools in the rare disease space. So we have different tools and acronyms that we've come across, PREMs or PROMs or PCOMs, and what we want to focus and talk about today are these patient-reported experience measure PREM tools. And it's a tool to evaluate the persons or people with rare conditions, their own experience in their own voice, this self-reported tool. So these PREMs usually are validated, but in the space that we work in rare disease, we as yet don't have a validated tool. So it's kind of key to stress that at the moment, that what we're doing is developing and designing this tool that will go on to be validated in this space. And these are a standard way in clinical practice to evaluate people's experience without any third party or facilitated interpretation. And we hope that they will improve patient and indeed healthcare
sorry to interrupt. Lucy, this is Ines. Sorry to interrupt you, but your sound comes out like a bit weird. Do you have a mic near? Yeah.
Yeah, I can switch. Thank you, Ines.
You're welcome.
I can switch, and then I'll mute it. Thank you. Hopefully this is better. You can hear me clearer. Yeah, sorry, we're just at a conference today in Dublin, so we're might be out of signal on my laptop, so I'm just sitting next to Stephanie and I might speak into her laptop. Is that any clearer?
Yeah, because it's a bit, it comes up not very clear.
And how about now?
Now it's a bit better. Continue.
Okay. So hopefully that's better. So yeah, PREMs allow us to assess people's own experience as well as their caregivers or supporters to people with rare disease. And yeah, we hope to develop this PREM and use in a pilot study in Ireland across hospital sites initially. And then we would ideally like to go out to tertiary care settings in Ireland, such as GPs, etc., and then use platforms such as Rare Barometer to further evaluate this PREM tool. So it can be used to monitor, evaluate, and improve the care received in expert centres such as ERN clinics and evaluate things like healthcare providers' assessments. And we'd hope in the future that it could be used to assess or to look at services such as hospitals' quality measures and things like ERN registries that are being developed and are hot on the agenda in Ireland. Anyway, at the moment, the conference we're just at, Patient and Public Partnership Conference, is all about this detail and data generation. And we'd hope that can be answered by all people living with rare disease and family carers, as well as, but not just patient representatives. And to say initially, we're using this tool in adult populations and caregivers of people with rare diseases. We'd hope to further develop this tool and include a children's version of this tool in the future. So there's a lot of unmet needs in the rare disease area, but the need, and we'd hope that PREM could generate data around the following areas, such as give kind of a snapshot in time of rare disease in terms of diversity, prevalence, and impact, and identify, hopefully for us, current gaps in this area, in this tool, such as access, safety, people-centeredness, and how people report on these. That if there is things like fragmented care, so something that's really topical in Ireland, and indeed for a lot of rare conditions, is around coordinated care. So it's really important for us that we look at this. The diagnostic odyssey journey. So if there's delays inside in the hospital or care, diagnosis of somebody with rare disease, we wanted to identify this, as well as things like unmet psychosocial care needs. So as I said, there's a lack of a tool in this space to capture this. So that's what led ourselves and colleagues to look into this. And I just want to bring you through our journey briefly and how we've come to the point now of having a tool that we can hopefully disseminate soon that would be developed into a validated PREM. So initially a scoping review was done of the literature, and studies like the Paris Framework Study was looked at in terms of what has been developed and what's out there. And this was the basis for our tool in terms of the areas and items that we'd look into. We then went in and generated questions and items under specific domains that I'd look at in a minute, and generated a tool that we used in expert consultation process, as well as interviews and focus groups with individuals that we have conducted here in Ireland. So they are the middle steps, kind of step 3 and step 4 in the design process. So in each of these steps, we've consulted with healthcare professionals and patient experts in this space to design this tool. We then came up using the data generated from that expert consultation phase and the interviews and focus groups, that thematic analysis, those themes coming through from those interviews. We developed a final PREM document and questions that we are going through and in consultation with Jessie, as you wrote us now, my colleague Stephanie, to have that final tool that we'd hope to then use to pilot in user research to ask individuals their input to those questions, that we will then go out to clinics and recruit to answer that question for us and disseminate. So that's the final steps 5 and 6 in the development there. So it's taken about a year in terms of the ethics submission and package and all these different design steps in the methodology to get to this point. We're very excited now to launch this study in Ireland. In terms of the areas that we've looked at in this tool or developed, there's been 11 in total that we've further kind of branched and broken up. The blue in this slide come from the Paris framework that are general to a PREM type of tool, and the green came through as specific for rare disease areas to look at. We further, because of our process and methodology and analysing the data that came out of our expert consultation phases and focus groups, we've broken up domain 10, diagnosis and treatment, into 2 separate domains there, one of diagnosis and one of treatment, and that final PREM. And we would say and highlight that every area here came through as important for the people questioned. There was nothing that was evidently rated lower than the others. Everything was really high up on people's level of importance. Just to say, briefly comment on the data that came out. We surveyed healthcare professionals and patient organisations. You can see here the 2 groups split up down in the bottom, and those different domains are coded by the different colour categories on this graph. And what we found in the 2 groups, the healthcare professionals and the patient organisations, is the same. 3 domains were coming out on top for both. So those are around trust, diagnosis and treatment interventions, and people-centeredness of care. So they were the top priorities for both. So just to talk about the domain in general, and to focus in on maybe one of those, as we had
11 different of those domains to go through. I just wanted to highlight one in particular, and in this case, it's around access. So to give a brief explanation, this is the ease at which patients can obtain or access their own healthcare services, things like timely appointments, logistics to appointments, convenient locations, duration and appropriate duration of the appointment, and any physical and financial barriers to access, so things like wheelchair access. So we can split up that domain, and if you think of it like shelves in a library or a bookshelf, so the location being one shelf, the duration and the waiting time, these are examples of separate categories in that domain, just to give you an idea of how we work through and categorize those different domains. So in this domain, when we split up the two groups, we saw that there was varying things coming up for people, varying separate items that were important. So for the healthcare professionals, one example here that came out as top priority was the process for making appointments, easy and accessible. Whereas for the patient representatives representing that patient voice, the appointment location, so the logistics of getting to that appointment in terms of convenience and ease of access was the most important there in that domain. And we also were very interested in the individual feedback and patient voice, or people with rare diseases voice. So we got direct free text responses back from people during this process as well. And this really opened our eyes to a lot of things, these people's own words and own voice. So highlighted in yellow here is a balance. Access needs to be balanced of patient needs and running an effective service. And something that has come up as a really key word in patient and healthcare partnerships is meaningful appointments and not just time spent for the sake of spending it. And again, somebody in the healthcare sector brought up around properly resource to deal with complex needs, which is very true for a lot of rare cases. So I'm just conscious of time. So just to talk about briefly another domain here, trust came out as one of the top domains for both groups. So things like confidence in healthcare professionals came out, and trust in your healthcare professionals to share information. And this is a back and forth dialogue with both groups. Yeah, and again, things like rapport and the relationship around people-centered care was really key for this domain. So we've ranked all of these domains coming out of our analysis as the most to lesser important, and it was on a Likert scale that we did this PREM analysis tool. So that's where we're at the moment, but what's next for us? So as I said, we're in the final stages of developing this tool, and it's taken an awful lot of work, and we're very grateful to colleague Jessie at Eurotis and my colleague here, Stephanie, and our work package leads here in Ireland, Vicky McGrath and Suja Samanajan, PI at UCD, to get to this stage and break new ground in this area. So we hope to be launching very soon, and we're in the process of ethics applications at these hospital sites in Ireland to launch this tool in collaboration with PIs, so the ERN clinical leads at these hospitals. We have Children Health Ireland, which encompasses a number of hospital centres in Ireland, Beaumont, St Vincent's, the Mater and Tala Hospital. So these 5 sites we hope to recruit 200 people in the next couple of months, 100 carers and 100 people with rare conditions to recruit to this survey. It's an online survey we'll be conducting, and we're very excited to start and get this moving. So I'll leave it at that, and I have my colleagues Jessie and Steffi here to talk and to answer questions if they've come up, and thank you for your time.
Thank you, Lucy. Thanks for preparing this. So are there any questions for Lucy, Stephanie, and Jessie? If not, I have one that is a very clear one, but I'll let you think first. So my question to you, Jessie, maybe is, Stephanie and Lucy, they're going to validate with those hospitals and those 100 people this questionnaire in English, right? In Irish, well, in English, English, I guess.
English.
And in the
English.
Irish system, yeah.
Yeah. So what happens with when they are done with that, they will be, the PREM will be validated in that language, and any English speaking country can use it, I guess. What about the others, and what about the translations?
So what happens usually for the validation is that's the usual process, actually, that one questionnaire is validated in one's language, and then it is translated into other languages and validated into those other languages. So when we talk about validation, I think we had at one point one ePAG meeting where we presented what it means to have a validated questionnaire. So it's a whole process. So it's not just the translation and having a good translation, it's also testing what the questions with people face to face to make sure that they do understand the questions as we intend them to understand it, etc. So it's a bit more than just the translations. And so usually what happens is that a questionnaire is developed and validated in one language and then adapted into other languages. At first, what we tried to do, and we tried really hard for many years, was to validate it in several languages at once so that it could be used as widely as possible. But I mean, like many patient organizations, it was a bit difficult to get the funds for that. So at least we will have it in English. And when Lucy was talking about Eurobarometer, it means that we will try and see how we can have it also in Eurobarometer, maybe not fully validated, but it's still something that we need to see. So first step would be to have it in English in the different hospitals in Ireland. And I mean, that's really a lot of work. You can imagine all the ethics approval. We have to have the final questionnaire to go to ethics approval. So that's a lot of work just to get there and to have it distributed in the hospitals. But that would be the first step. And at the same time, on our side, we'll try and make sure that we can have it in several languages. However, even if it's not fully validated in the other languages, I don't know how clear you were about that, Lucy, or for those of you who may have missed that information, actually the healthcare professionals and the patient representatives that gave their opinion on the framework of this questionnaire, on the dimensions and the categories, they were coming both from Ireland and from the European network. So they had this European or foreigner or different points of views, so that the categories could be really adapted to the different healthcare systems, at least. And so, and I can say already, because we are quite advanced in the writing of the questionnaire, that the questions could quite easily apply, I think, to different healthcare systems. So I think that once we have the questionnaire in English, we have a good chance that we could use it quite easily then in other languages, as long as we have at least an official, if not a validated translation. But that would be already a very, very good start, I think.
Okay. So hospitals in France could translate it and have something that they can use and get good data out of it, even if it's not validated.
So the ideal way to have validated translations is really to have a research team doing all the validation, not only the translation, but also the validation in another language and in the country. But in my experience, even if we don't do that, if we don't have research teams in every country or in every language, as long as the questionnaire is there, people will start to use it. And that's already our experience with the ERNs, because if some of you followed the very first steps of that project, which was already in 2019 with a pilot that we did as Eurobarometer, we used a scale that was, or a questionnaire that was developed for chronic diseases, and we saw that it was missing something for rare diseases. And for instance, diagnostic, treatment, it wasn't there. And still, because it was there and it was tested on rare diseases, some ERNs already use it in their registry because it is there. So I think that once we will have it in English, and especially if we have the translations, and even more if we've already used it in a Eurobarometer survey, for instance, and in that way we would have it in 25 languages, it will be there. It will be there and people will use it.
Hopefully.
Yeah. I mean, if they want to use something, they will use this one, and we will have the questions that are meaningful to the patients and the family carers and the healthcare professionals.
Fair enough. So is there anyone that knows about any other PREM that is being developed or used in any expert centers? Are you aware of anything that's going on in this area? No.
I have heard, and please correct me if I'm wrong, if there's a colleague here representing this, but actually from Barcelona, that they were thinking to develop something also for use with children and young people for rare diseases.
Yeah, there's been several projects, I think, in Spain, actually, either at hospital level. I think Sant Juan de Déu is quite advanced.
Well, we have Joan in the call, but I'm not sure if he's listening. From the Sant Juan de Déu. Joan, are you there? I put the spotlight on you.
I'm here. Thank you. Yeah, what I can add is we are trying to develop PREMs. Then maybe on what's mentioning Jesse, just to build on what you were saying. For example, now we are kind of developing a very basic PREMs, more generic, with some of our partners in Europe. We are 5 hospitals. Finland, Denmark, Vienna, UK, Spain. We are developing a generic PREMs and Sweden. And what I can say is that, for example, in terms of the things that you were saying to validation, it's a long process. There is some standards and they are published and you have to follow up, which means that first you need ethical approval, then you need to do the forward translation, then you need to do the reconciliation, then back translation review, then harmonization, the cognitive test and the briefing, then review. So it's a long process to do it, and I would say probably it could take 7, 8, or 9 months. But I think it's it's necessary. Depends on
even if the questionnaire already exists. That's when the questionnaire already exists.
Exactly. Yeah. No, that's the point. In our case, we are doing that, and with a questionnaire that already exists, that was developed by the Karolinska Institute, and it's taking very long. So we are thinking to validate. It will take, and then of course there are different speeds in each country. But I think it's really good what you are doing about, first to have something very solid in one language, because then once you have that, it's much easier to apply in others.
But Joan, would you use the PREM that we are developing, for instance, even if it's not validated, but it's with a good translation, etc., just translate it, or would you not? Yeah.
No. Here, you have two different mindsets. If you ask me, I will say yes, because the best about doing nothing or doing something, I think always it's better to do something, because I'm sure you will get feedback, and you will get feedback that it will be very useful to do the refinement. So for me, I think it's my opinion is that you are doing the right thing. If you talk with someone that have this very kind of scientific mindset, they will say no way. First you need. I think it's really good what you are doing, because you already kind of validated, and now you will get feedback that it will be very useful for the refinement of the questionnaire. And then, you could develop something more robust. And once done that, then you can do the validation. So yes, from my opinion.
Yeah. Okay. Hopefully we have some pragmatic minds out there in other hospitals. Because validating is a very lengthy process, and it's not only lengthy, it is expensive. You need
exactly. Yeah.
Okay. So if no one has any further questions, we can close this bit of. Okay. So I just want to thank again Laurie and Stephanie and Jessie for being there today and providing this update. Now you are aware of what's going on.